Good evening, everyone. Thank you for joining us today. My name is Nina Narwada. I'm the president of the Advanced Nursing Student Organization. For those of you who will be graduating this spring, I wish you the best of luck finishing your last semesters. After graduation, you can keep your NYU email address for life, and you will have access to benefits and services exclusive for NYU alumni. I know there is a lot of curiosity about what will it be like for the first year as an advanced practice nurse. How do you build confidence as a provider? How do you interact with your new colleagues? What is a job search like? So today is the perfect day to have several alumni here to speak about the transition from being a registered nurse to an advanced practice nurse. I'm now going to take a moment to introduce our panelists. So our first panelist is Christine Baruch. She graduated from the informatics program at NYU Meyers in 2023. Christine is a quality improvement specialist at Hackensack Meridian Health. Meg Fent graduated from the midwifery program at NYU Meyers in 2020 and the baccalaureate program in 2014. She is a certified nurse midwife, registered dietitian, certified diabetes care and education specialist, and works as a midwife at North Central Bronx Hospital and ULA Health in Brooklyn. Edward Finesca graduated from the primary care NP program at NYU Meyers in 2023 and is currently in the DNP program. He is a nurse practitioner at NYU Diabetes and Endocrine Associates. Jenna Goldstein graduated from the pediatric NP program at NYU Meyers in 2021 and the baccalaureate program in 2017. She is a nurse practitioner in the pediatric ER at Children's Hospital of Philadelphia. Emily Howson graduated from the Family NP program at NYU Meyers in 2023. She works as a nurse practitioner at Optum Primary Care. Ashley Johnson graduated from the Masters and DNP at Columbia University in 2021 and the baccalaureate program at NYU Meyers in 2017. She's currently a nurse practitioner in inpatient neurosurgery at Stanford Healthcare. And last but not least, Giselle Perez graduated from the Psychiatric Mental Health NP program at NYU Meyers in 2021, and she's a nurse practitioner at Mount Sinai West. If you have any questions during the panel, please type them into the chat, and we will get to as many as we can at the end of the discussion. When the panel concludes, everyone will have the opportunity to enter breakout rooms with the panelists to speak with them one-on-one. Okay. So let's get started. So for the first question, how did you prepare your boards? Compare NP to RN boards. Giselle, would you like to start us off?
Sure, yeah, I'm happy to start. So I graduated from NP a few years ago. One of the main differences, I think, was my approach to studying for my boards comparing my NCLEX to my psychiatric certification for the boards. So each board exam is different depending on your specialty. One of the main differences, I think, was how I was studying. With the NP boards, I used kind of additional resources. I used a book specifically from the ANCC that was specifically for psychiatric, mental health, nurse practitioner students or professionals, right, preparing for the exam. So I used that as a guide. I also would use Board Vitals and other online resources as I was practicing. So a lot of practice questions, practice tests. And I really studied kind of very intensely for about 2 to 3 weeks, which was very different from my RN, from the NCLEX, where I studied for a longer period. And a lot more anxiety, I think, related to my NCLEX, as you hear horror stories about it. And overall, I felt like it was a lot smoother than studying for my NCLEX and taking those boards. And another nice kind of distinction is that you get notified right away if you pass your boards that moment after you take the exam, and you don't have to wait a day or two or 3 days, right, depending compared to your NCLEX. So overall, I thought it was a smoother process.
That sounds nice, especially since it's like much faster, the results.
Yeah.
So when do you think the NP students should start looking into the process of like
Yeah. So
applying?
it took me the whole process about a month and a half from graduation to taking my boards. I don't know if it was a little different for anyone on the call. I know we have other MPs like Ashley on the line, but for me, it was about a month and a half process.
Okay, and does that mean that you get to become eligible like very quickly after graduation, or does it take like a month as well?
From what I recall, after you graduate, everything is cleared. It's kind of a lot quicker than you don't have to wait for an authorization to test from the state and things as you do from your NCLEX.
Oh, sounds good. Thank you for that, Giselle. Next question. What are the questions you should be asking when on an interview? Jenna, would you like to start us off?
Sure. So I think kind of the big things as you are getting started, you're interviewing, right? There are specific questions, right? How many hours a week? What do your shifts look like? If you're clinical, working eights, are you working 12s? Are you working nines? But then there is nitty-gritty in that. One of the things I really encourage people to ask about is time for documentation. Because if you're working clinically, that is a huge time suck, and often that is not necessarily accounted for, right? So is there administrative time to work on notes, to handle an in basket if you're responsible for that? So those things. And then, especially for your first job, I cannot encourage you enough to ask, right? Do you have other NPs or PAs there? Have you trained a new grad before? What does that training look like? What are the supports available? You want to ask about retention, right? How long been at this job, because if they're having a lot of turnover, that may be something to think about. And you really, really want to, if you can, to take your time and search for the job that has kind of that right fit. You can always ask in an interview to do some shadowing. One of the ways I ended up at the job I am now is that actually before I could even ask, they were like, "Oh, do you want to come shadow?" And that was a really good green flag for me, because what it showed me was that not only were they interested in making sure I was a good fit for them, they were interested in making sure they were a good fit for me. And that's huge. And so I actually turned down two job offers I had before I took my first job, because I had the luxury of I kept working at my RN job and I didn't hate it. So I had some wiggle room to really take my time and find something that felt like it fit.
Thank you for that, Jenna. Meg, is there anything that you'd like to add?
I echo everything that Jenna said. Super important to find um, out about your schedule. That's as a midwife, that's like the number one hugest thing, because I'm on call and I do nights and weekends. And how many holidays do we have to do? How many weekends do you rotate in and out? So similar, if you were working bedside as an RN, you would want to know that stuff as well. Um, Admin time is huge. Also, like Jenna said, like there are some jobs where I've been responsible to parse through and call back every patient for every lab I've ever ordered, and then other jobs where I don't have to do that at all. So that plays a big role in your quality of life and the time that you're going to have to give. And if you have admin time set aside for that or not, that's going to impact how often you're working when you're not at work. Um, One of the other things too that I would suggest is asking about your backup system. Like as a midwife, I always work with an OB backup, and asking how the people who are not NPs or midwives or advanced practice nurses around you, how they work together with you, because sometimes they're very, very loving and caring and they love having you on their team, and other times you are their grunt person, and that's something that you would want to have some clarity on going into the job. Like, are we team members or am I the person who gets the short end of every stick? I don't want that. And also, do they want me here? Right? Because sometimes there's a little bit of headbutting between advanced practice providers and some other professions. And if that's the vibe, then you would want to hopefully know that before. And most places, like I've straight up asked that question at interviews, like how did the midwives get along with the attendings? How do the PAs act towards us? Like, what is it like? Um, and I usually get a straight answer, which is lovely. So that's my recommendation. And orientation, obviously, like the longer your orientation can be when you're new, the better it is. Huge red flag if somebody says there is no orientation. There always should be an orientation. And I would say it's a yellow flag if they say your orientation is like 2 weeks. my orientation for my first job was 6 weeks, and that's a place that I had done like almost a year of clinicals at. So I already knew the system in and out, and they still gave me a 6-week orientation. So ask.
Thank
For
you, Meg.
oh, I was just going to say, for comparison, I started at a brand new hospital I had worked in a pediatric ER as a nurse, but not at that one, and I got 12 weeks. So
Wow.
you will want it, and even those 12 weeks, you come off and you're still like, not sure I know what I'm doing yet.
Thank you, Jenna and Meg. Next question, was finding a job something you felt you had to readily do upon graduation, or did you take some time since you already had a job as a registered nurse? Ashley, any thoughts on this?
Yes. My first job as a NP was actually I did a fellowship at Memorial Sloan Kettering in neuro-oncology. And a fellowship, is not for everyone. Um, it pays less money, but it's basically like a year-long orientation, especially if you're very interested in that specialty. And for me, I was always in neurosurgery and neurology. Um, so I didn't feel like I had to get a job. I felt comfortable enough in my life. I had no real responsibilities then that I can take the pay cut, and I kept my job as an RN. I went per diem. Um, and then when I was finally ready for a full NP job, non-fellowship, I knew I was moving to California, and I wanted to kind of have a buffer and the time to do that. So while I was at my fellowship, I had gotten, my certifications for the state of California and started looking. And by the time my fellowship ended, I had a job lined up already. But the short answer is no. I didn't feel like I had to find a job upon graduation, because you also want it to be a good fit for you. You don't want to rush into it. Um, it's a you're doing a lot more, I think, as an NP. Like, things are a lot different. So you want to make sure you're in the right place. And if you're not, I mean, you can leave, but that is my opinion.
Thanks, Ashley, on your thoughts about that. So next question, what was your biggest challenge in your first year as a master's prepared nurse, or the transition from bedside nursing to an administrative or leadership role? Meg, do you want to jump in on this question?
Sure.
Thank
In
you.
my role, I worked as a registered nurse in the same place that I now work as a midwife. So there's a little it's a hard shift to do personally when you have coworkers that then now I'm like giving orders to. Not that, and I say giving orders in the sense of like I have to put orders in Epic and then they have to follow them, right? It's not like, hey, I'm shouting at you to like follow what I'm telling you. But the dynamic is very different from being a coworker with these people to then like having a provider nurse relationship. So that part luckily was pretty smooth. It just was a very weird headspace to be in to get used to that. Um, the other piece that was hard was to stop being a nurse because I am in the same space where I acted as a nurse, and now I have to shift my head to be a midwife, which has different roles and responsibilities. So when I was orienting, one of the things that somebody kept saying to me was like, you need to stop being a nurse. Like, you're not a nurse anymore. Now you're a midwife. So like change your brain, shift your head, start to do this different role now that you have been trained for. And there still are times, like I was at work last night and there were too many patients and not enough nurses. So I was half of a nurse again. Like, I have that skill still in my brain. I can do all the things. It's just learning to delegate instead of just doing. So that part was a learned skill, a little tricky to learn, but comes with time. But also a lovely gift that you have, that you can do the job of a nurse if you needed to help to train somebody, or if somebody was new and they needed a little bit of guidance. It's a really lovely thing that you can still draw on that when you're around people who might need your help or guidance. never lose your IV skills.
Thank you, Meg. Edward, would you like to add anything?
I don't know if Edward is on.
He is not on tonight, unfortunately. He got waylaid at work.
That's okay. Would anyone else like to add anything to that? Okay, that's fine. We can move on to the next question. So what skills or experiences from bedside nursing have been most valuable and perhaps transferable in your leadership or administrative role? Christine, any insights on this?
Yeah, sure. So just for a reminder and background, I'm not a nurse practitioner. But so some of the things that we kind of take for granted in nursing is that we wear a lot of hats. And if you want to transition into like a leadership or an administrative role, you kind of have to be creative in the way you sell your current characteristics and your skills. So being able to publicly speak, being able to take medical jargon and translating that into more a palatable sentence, or to be able to convey to people who don't have a clinical background so that they can understand what people at the bedside need, especially if you find yourself, because in these administrative and leadership roles, you'll find yourself in rooms with C-suite level executives that have no idea, or if they do have an idea, they've been away from the bedside for years. So my recommendations would be, participate in your unit-based councils. If there's ever a project on your unit related to quality improvement, anything to kind of get your foot in the door where you can write on your resume, or at least be able to speak to in an interview that you've been able to kind of lead meetings, organize groups where there was an objective that you completed together, or maybe being able to speak to completing a goal on a timeline with a deadline. All of that will translate into an administrative or leadership role, because the way it is now, especially after COVID, everything's on Zoom, everything's on Google Meet, you're sending emails, you're managing projects. So if anyone's interested in that, definitely focus on skills that you can use to pivot that's used in nursing, but can kind of, you can use it to your advantage in an interview or in a different setting.
Thank you, Christine. That was great. Next question. How did you handle difficulties that arose with the medical team or patients, especially if you stayed in your same facility? Emily, any thoughts on this?
Yeah, so I think that Meg can probably speak more about staying in your own facility, because my first job as an NP was in a new practice, so it was establishing new relationships with everybody. But I really think that communication and doing it in a respectful manner, whether it's with a patient, a colleague, a physician that's overseeing you, is the kind of the only way to go. In the nature of our roles, there are going to be people who are going to be challenging us, whether it is our patient or our colleagues, and just being confident in your role. You are a master's prepared NP or whatever your role is. Always remember that you have that training. So be confident in your decisions. And then always have allies, whether it's from your friends and peers in master's school, or your colleagues at work who you really trust, and have them as a sounding board to have these discussions and see if they have any insight to offer. I found it really helpful because a lot of the physicians who I work with have been practicing for a really long time. And so establishing good relationships with them to have them be my soundboard when I do have questions or situations that come up.
Thank you, Emily. Meg, would you like to add anything?
Yes, I agree wholeheartedly with Emily. And also will add that just because someone's been working longer than you doesn't mean they're doing it right. So if you have something in your brain that you're like, I'm pretty sure I know that what I'm saying is right and what they're saying is wrong, like practice challenging other people in a way that's kind and helpful. So like one of my little tools that I use if somebody says like, hey, the risk of stillbirth goes up after 41 weeks. I'm like, no, it doesn't. It goes up after 42 weeks. Instead of being like, no, you're wrong. Like, oh, I heard you say that. I'm pretty sure it's 42 weeks. Like, can we look that up together quick? Instead of being like, no, you're an idiot and I want to challenge everything that you say, but also be confident that like you learned what you learned and guidelines change, right? So especially in OB, like the way that people practiced 30 years ago is not the way that guidelines are telling us to practice now. So being confident in what you know and finding ways to use your voice that's not like confrontational in a negative way, but shows that, hey, I'm trying to give this patient the best care and what you're saying is not evidence-based, so can we talk about it? And always fall back on your guidelines, whatever field you end up in. Like for me, it's ACOG and ACNM. Like if somebody's saying something wild, I'm like, it's all written down somewhere. Like it's all online for us to find together. So if we need to sit down and look at the guidelines together, all right, whip out my phone, up to date, ACOG, it's all in here. So like, let's look at it together. But be confident that you do know something. Even if it feels
Yes.
like you know nothing, you know a lot.
Thank you, Meg. So what would make an ideal overall orientation? I know you guys have mentioned having an orientation in general, whether it be 6 weeks or 12 weeks would be great, but I guess overall, ideally, from your perspectives, what would have been the best orientation for you or what you would have liked to add in general? Meg, would you like to start us off?
Sure. So I can tell you what an orientation should not be. It should not be you doing the job when they say that you're on orientation. So sometimes you go like this thankfully has never happened to me, but some of my midwife friends like started a job and they said they were on orientation and she's like, no, I have like not 40 patients. She had like 26 patients on her first day of orientation. I'm like, that's not orientation. You're doing the job without getting any training. So being very clear of like, who am I shadowing? Which means that somebody else has the panel, somebody else has the patients, and you are not the primary provider for that day. Who am I shadowing? Who's training me? And tell me who I'm with every day. Because if you tell me I'm with no one, that means I'm doing the work instead of getting trained. And also finding ways to get time for all of the trainings you have to do, like whatever hospital you're at, you're going to have a list this long of like all of the annual trainings and the things that Epic needs you to learn, all that crap you're going to need time to do. So where's my time to do that? And then hands-on skills, depending on where you end up and what skills you're going to need to learn. Like where is there sim class? Like when are my sims? When am I signing up for them? Like get it all written down so that nobody can be like, oh, it's been 3 days. Like here you go do the job. Like have it planned out in a way that you have it documented somewhere is my recommendation.
Thank you, Meg. Would anyone else like to chime in on this question?
Yeah, I was just
Um,
going to echo, I can't remember if it was Meg, if you said this, but certainly ask if they've trained a new grad before, because that was something that I did not ask in my orientation and did have a little bit of a very steep learning curve because I was the only NP in the office. So definitely inquire if they're used to training new grads, what their protocol is, if there are other NPs in the office or in the organization that you can reach out to if you have questions. You definitely want that support.
Thank you,
And
Emily.
with that, I think another question is what is the ramp up to a full patient panel or full patient workload? And it's okay if that is not like super strict. Week 1, you're going to have X, week 2, you're going to have Y. When I train our new grads in the ER, it's not always that prescriptive, but it's, you have 12 weeks. So week 1, I'm going to start you off with 1 patient at a time. And I want to see you get comfortable and then slowly ramp up. So an acknowledgement that like you're not going from 0 to 100. What does your precepting look like? Are you one-on-one with the preceptor, like Meg said, where you have someone you're shadowing? Are you, or does your preceptor have a full patient load while you also have one or two, right? Because then they're not going to be able to give you as much attention. And that may be okay. Again, as long as, right, you have that support, are the docs involved in your orientation? Are there other classes? Are there other people at the organization you want to shadow? My current job uses NPs and PAs very interchangeably. And so for one of our new grad PAs, we arranged for her to do a shadow shift with some of our PICU RNs just because she had no clue what went on in the ICU. And she was like, that is going to make me a better PA. And so just, right, what does that support look like? Is there an option to extend orientation? And all those kind of ramp up questions, because you are going to feel like a new grad all over again, right? If you remember all the things from your time as a brand new RN and being like, oh my God, you're going to experience that again, which is okay. It's not a bad thing. It's a scary thing. And so just what are the things people are going to do in your organization to support you through that transition?
And also, if your contract says that they can let you go after X amount of months, like if it's not a good fit, it's a, whatever they call it in New York State, at will employment. Like if it's not a good fit, you might not be here in 3 months. Like when are my check-ins so that I know that this is working out for both of us still? Pretty much all my jobs had at the 3 month and 6 month mark, like freedom to fire me if they didn't want me anymore. So just like read your contract and ask that too.
Thank you, everyone. What would have been helpful to know before graduation? Ashley, any thoughts?
Yes. Ugh, honestly, that's hard. I feel like it was so long ago that I graduated. Um, I think we all have this fear right before graduation of, will I pass my boards? Will I get a job? Will I be happy? And I think the answer to all those questions that you don't know in the time that it's going to be yes, you will find a job, you will find the right fit for you. You may not find it on the first try, but you will find it. So I think having the comfort before graduation, I know that's easier said than done.
Thank you, Ashley. Emily, any thoughts on anything helpful to know before graduation?
Yeah, I mean, I agree with what Ashley said, and I think that this really ties into all of the questions that were answered before. I think making sure you're asking the right questions before you, when you're interviewing, look into which boards you want to take, what study programs you're interested in, and then also, have the mindset, like Jenna was mentioning, that it is going to be a big transition and it is a pretty steep learning curve, at least in my experience. The first few months of being an NP up to 6 months, it's a huge role change, and just know that that's normal and that we're all going through it, and you'll get through on the other end.
Thank you, Emily. And last question, what do you like most about being an NP or a master's prepared nurse? So this question is for the panel. Ashley, would you like to start first?
Yeah, sure. What do I like most about being an NP? For one, this may be an unpopular opinion. I really like my schedule. I feel like a lot of NP jobs were like 5 days a week and outpatient, but I got to keep my 3 days, 12 shifts. So I loved keeping the same type of schedule that I had as a nurse. It was just beneficial to my life circumstances. Um, I love, I think Meg had touched on this earlier about, you have to learn how to delegate and turn your nurse brain down. But I love it when those situations come up where like I need to turn my nurse brain up a little and use both those skills. I love having the background as a nurse and being able to bring that my to my job. I work with a lot of PAs, and so there are a lot of nursing questions that come up like when we're ordering certain things. And so I love having the background of both.
Yeah,
Thank-
I agree with Ashley too. I think that you know, having the background of being a nurse is super powerful. And I've connected with a lot of patients who have come in just saying, I'm so glad I'm seeing a nurse practitioner. My experience has been wonderful with them. They really take the time and communicate and get to know me. So I think that we do offer you know, a great difference compared to some of our colleagues, just because we have that nursing background. And I also like being autonomous. I work in primary care, and you know, I see patients independently. I don't really have a report to anyone, and I like being autonomous and creating relationships with patients and being able to work with them.
Thank you, Giselle.
Also piggybacking whatever everyone else has said, but also I like the flexibility with being an NP, like having more like different opportunities in different areas. So like I do clinical teaching, which is really rewarding. And then also feeling like a little more autonomy with your patients, kind of being able to even further, right, like deliver more individualized care while also having like that nursing perspective where we have, you know, we're often the person who spends the most time with patients. So it's nice to be able to integrate both of those.
Thank you, Giselle. Christine.
Since my role is a little different, I don't see patients, but I kind of want to echo what everyone else mentioned. I really like the flexibility of my role. I'm able to work from home 2 days a week. I'm able to move my meetings around so that I have a huge block of time where I can just work on things. And yeah, I would say I can work at the hospital, I can work at my desk, I can work at home, I can work on the go, and that's pretty much the best part of this role.
Thank you, Christine. Meg.
I'm eternally jealous of Christine. My schedule is the worst. So that's not my favorite part of this job. The babies are born at any time of day and the schedule is everything. But I do enjoy taking care of people in a way where I have a little bit more like power and control are the wrong words for this, but I can't think of anything else right now because I'm post-call and my brain is tired. But like the ability to kind of run the show at a birth, for example. Like I'm the person who says, hey, we're not going to do this. We're going to do this instead. We're not going to touch her like that. We're going to do this instead. Everybody be quiet. We're going to bring the energy down here. It's a good feeling to be able to bring that to that birth space instead of as a nurse where I was a little bit more like, oh, this person's telling me what to do. So I kind of have less of a voice. Um, and then I genuinely love doing like office visits. Like I didn't think that I would ever like that as much as I do, but I really, really love doing that work, like pap smears, birth control, IUDs, like abortion counseling. There's just so many things that you can do when you have your advanced practice degree that you will never be bored. You can make a million choices in life. And like Ashley said, the nursing part never goes away. And it is fun when that part gets to come out and play a little bit too.
Thank you, Meg. And last but not least, Jenna.
Yeah, bringing that nursing part out to play is so fun. I am still riding a high from a few months ago where I dropped an NG tube that one of our very, very senior nurses couldn't get. And like we saved this kid from a trip to IR for having, right, just the silly little things, but it's like, no, I've been on that back end and I can do it. And that for me is the biggest thing. Like we think of healthcare a lot and you talk a lot about healthcare in silos, right? You've got your providers here, you've got your nurses here, you've got your techs here. And I think one of the most valuable things for me is the ability to talk across those different roles, right? I function in my job really interchangeably with our residents. For our higher acuity patients, I will see them myself. I'll get things started, and then I staff all of my high acuity patients with an attending physician. If I'm seeing lower acuity, I get to do that myself, which is also really nice because then I get my independence. But like I have been able to form these incredible relationships. I'm going on 4 years at my job now with our docs, where even with a really sick kid, they're like, oh, great, Jenna's got him. no worries. And that's really cool. That relationship, that trust, that like you actually know what you're doing and you can really help is very fun. And then the flip side of that, I walk into a shift and some of the nurses are like, "Oh man, Jenna's on our team today," and like their excitement. And so being able to speak to both sides and both worlds, I think, has just been a very cool thing I did not expect.
Going to move on to the next portion of the event, which is a Q&A. So we're going to start with questions that we got in the chat. The first question, this any panelist can jump in. Were there any clinical skills or topics you wish you reviewed more before you started your first job?
I think this depends on the specific specialty that you're deciding to do. For me, it was neurosurgery, and so there were some things that I did know as from when I was a nurse, but there's now a whole world of things that I don't know, like the intricate parts of these surgeries, of a lot of things. And so what you can do when you're onboarding for that job, or when you're interviewing, ask them what books do they recommend, what resources do they recommend that you have. Like Jenna was saying, some of us operate kind of interchangeably with the residents, and so you can ask, hey, what resources do the residents usually use? And what kind of education do you guys have to offer me, like grant rounds and things like that. But yeah, I think that'll be your best route. Just it depends on the specialty that you decide.
I agree. I feel like lab interpretation was something that got me a lot early in my career. I would just spend endless amounts of time like looking things up. And in pregnancy, like the normal labs for non-pregnant people are not the normal labs for pregnant people. So having a little bit more of that under my belt probably would have made my first few months more smooth. But again, you got up to date in your pocket. You got things that you can look up, and I still do. So there's always time to learn.
Thanks for sharing that. The next question. Oh,
sorry. No, I will also just say, don't make yourself crazy about it. You're going to be studying for your boards. You're learning the stuff you need to learn for your boards. And I think very much like your RN jobs, where your job right now is to learn the material for your boards, learn how to take a good history, learn how to do a good physical exam, start being able to come up with plans for your patients. You are not expected to know it all by the time you come out of your master's. And any place, and this is, I think, what Meg and I were getting at really when we were talking about orientation, any place that expects you to have it all figured out when you're done with your master's, it's probably not a great place. You're still going to be learning, especially if you go into a specialty. And so, yes, touch up on things. Yes, think about it, but also take some time off. Like, you don't need to know it all when you're on day one of the job, and you're not going to.
Thank you. Does anyone else have anything to add? Otherwise, we will move to the next question. Okay. So a question for the NPs. There's two boards, the ANCC versus ANP. Do you have any thoughts on like what are the differences and like which one would you take?
I chose the ANCC. To be honest, I just liked having the BC, which was silly, but I think that the two exams focus on different topics. I think the ANP is more about like clinical practice, patient care. ANC is a little bit more comprehensive. I think it does more like theory and practice and research. And I know that the ANC does have more questions. I think it was 175 questions. So that's why I chose.
Thank you. Anyone else?
I think for psychiatry, we only had the ANCC option. So it was just automatic.
Same with midwifery. There's only one option.
Okay, so the next question, any tips on finding a good collaborative physician?
For me, my collaborative position was assigned to me. I did not have any choice or input in the matter.
It was the same situation with me. I interviewed with, it's a very small team. There were two psychiatrists, and I interviewed with the psychiatrist who would be my supervisor. So he would be my collaborating physician. So
I think this is also an interview-based question, right? Who supervises what, and then what is that relationship like for people there, right? Because there are collaborative physicians who, you know, are there if you need them, and then there are people who want to micromanage everything you do. I've been at places or seen places that do that. And then there are places where they're like jazzed to have you as a member of the team, or places where they're like, oh, we have to work with the APPs again. And so I think that's, again, in that job, you're probably less likely, again, depending on where you work, it's kind of rolled into that job choice.
Thank you. So the next question is, in regards to your first job offer, did you negotiate the salary, or do you think it is appropriate to do so?
I think it's always appropriate to do so. And figuring out how to do so is very, very nuanced. Personally, I did not negotiate my offer for my first actual NP job, non-fellowship, and that's only because it was a generous offer. And it was what I had wanted. If I had stayed in New York, they were offering less, I would have negotiated that. But yes, you should negotiate. You need to know what is the number that you want. And if you find a job that you like and it's not the number that you want, then I would always say negotiate. Don't just take it just because you're a new grad. You know, living is expensive.
Yeah, agreed. And know the comps in your area. I moved outside of New York City when I took my first job. So know the differences between, salary in New York City is going to be way different than salary upstate in New York. And then when I was negotiating with my first job, I was in between two offers, and making sure that you have admin time for that charting. And if you can negotiate that, sometimes HR will be receptive, and sometimes they won't. But the worst they can say is no. And you can always just go back to the drawing board.
I would say the other thing to consider is whether it's a union position, and whether it's a union position or not. Like where I work, it's a union position, so it's non-negotiable. It's just based on like your years of experience with the organization, your external experience, and then like certification and education level. That's how they calculate your base. So it's already kind of predetermined. So it depends. Whereas if you go somewhere maybe outpatient or non-union, not outpatient, sorry, non-union organization, it might be different, and you should then definitely try to negotiate.
I agree. I've worked in union places where they're like, thanks for your thoughts. This is what you're getting paid. And then other places where I've used not my midwifery experience, but my previous nursing and diabetes experience to be like, I have more skills than anybody else who you're looking at. So I do deserve more money for that. Easier to do when you have some experience in the field, though. Hard to do when you're like a freshie, because you're going to cost them time to like onboard you. If you can hit the ground running and you have skills, then yes, you're worth more money. I also will say, like, I know it's taboo to talk about money with people, but I highly encourage, if you find a good group of people around you, talk about how much money you're getting offered at your jobs, because there have been times where like two people have interviewed in the same place. Like, why did they offer me this much money when they offered me this much money? Like, what's going on here? And it's legal in New York State for you to talk about how much money you make, and it is illegal for your employer to tell you not to talk to each other about how much money you make, but employers still will say that. It's my favorite retort. I'm like, you know that is illegal for you to tell me not to talk about how much money. But there's power in you knowing what other people around you are making and what the comps are, or what somebody else is getting offered for the same position. because there's no reason if you have the same experience that you should get offered a different amount of money.
And just to add on to that, right? It's not just money. It's not just money. It's your vacations. It's your money for CEs and money and time for CEs, and reimbursements for recertification for your DEA if you need that. That is a hefty chunk of change. And so, right, even if they're not going to negotiate on the number on the page, there are a lot of little things that there may be a little bit more leeway for, and definitely contribute to overall compensation.
Yeah, because a higher salary, you might not have the DEA, you might not have the CE time, and then you're like, well, that's $10,000 that I'm missing out on, right? And a flight to wherever I want to go for my CEs. So, and health insurance, like I've had widely different types of health insurance at different jobs. Some where you're like paying $1,000 a month out of pocket, and somewhere it's zero. So that also plays into how much take home you have. So look at all that stuff.
Thank you everyone for those tips. The next question we have is, what are the general pros and cons of fellowships? Do you recommend them?
I did a fellowship. I'm not sure who else has, but I can try to answer this question. So mine was a year-long fellowship. Some of them are could be a year and a half or 2 years. It just depends. Specifically for my fellowship, the role for a neuro-oncology APP fellow was, I was the first one. They had other APP fellows, but it was like solid tumor and other things. So I think that was also a challenging part, is that they were still trying to like figure out what to do with me. And so they would basically set me up in different subspecialties. So I spent like 6 weeks with neurology, 6 weeks with like the consulting team, 6 weeks in the neuro ICU. And within all of that time, there were still like the people that were training me were all different, like my preceptors, and they were also, some of them didn't really know, how to teach me or like what to do, because everyone doesn't teach the same. So I think general pros, again, it's like a year-long orientation. Like you have all this time to ask all the questions, to take your time to figure out how to document, how to get a really good history and physical and all of these basic things that you should do within your first year. And then some cons, I think, again, just some people, when they have, even if my role wasn't new, I think some people, when they have an ABP fellow, it's like, they're just going to give you either the grunt work, or they're not going to pay attention to you, or again, they're just not going to know how to teach you. I think overall, I had a good experience. I'm glad I did it. I learned a lot, and I felt a lot more comfortable when I stepped into my first NP position on my own.
So I actually was part of the last-ish cohort at my hospital that was hired without doing a fellowship. So I can kind of speak a little bit to that. Again, I had a really nice supportive orientation, which helped, and I think made it a smooth process. Things that are nice for our fellows. We actually allow our fellows to start without being fully credentialed. And I can see in the chat that someone was talking about transferring credentials. I'm down in Philadelphia. I accepted my job offer at the very end of August. I was supposed to start at the beginning of January, and my start date got pushed back to mid-February. So just to give you a sense of how long transferring licenses took, and then getting credentialed at a hospital can take forever. So our fellowship actually allows our new grads to do some work during that time, which is pretty cool, because I, in anticipation of that January start date, left my old job at the end of in mid-December, was like, great, I'll be off for the holidays, I'll have a month off, and had budgeted for that. Had not quite budgeted for 2 months off. And so just being aware that things like that. So that can be really nice. It is a lower starting salary while you're in the fellowship program. So that is definitely something people sometimes don't like about fellowships and can be one piece of the puzzle. And then one of the things I think my department in particular struggles with is it is for all new grads, both NPs and PAs. And so coming with some different backgrounds, so they may not all need the same thing. And ER is very different than inpatient. And so that can also be challenging for some of our fellows because they're like, I'm getting this great education that I'm not actually sure is relevant to a lot of the stuff I'm doing. So I think pros and cons, I think it's really going to depend on your particular situation, whether, you're trying to get into a really competitive specialty or you're trying to get into a specialty you're not as familiar with. A lot of critical care areas I know now do fellowships, and that, right, seems reasonable, right? You're working with critically ill people. But I think if you have a good orientation, it may not be necessary.
Thank you. Anyone else have any thoughts on fellowships? If not, we can go to Jenna mentioned credentials. We'll ask that question. A student particularly wanted to ask Ashley how long it took you to transfer your credentials from New York.
So my credentials aren't transferred. I have credentials in both New York and California. I keep them both up because there will come a time where I'll probably move back to New York. So I'm certified in both places. Credentialing in the hospital is a different process, and Jenna touched on that. That can take a couple of months. But to get my California, like the licensing stuff, so you need your RN license, your NP license, and for the state of California, you need a nurse furnishing license to prescribe. All of that took maybe like 3 months each, because you have to have the RN license already. And then you can apply for the NP license. That's specific to the state of California. Your DEA, however, you can only have a DEA in one state, as far as I know. So my DEA did have to transfer to the hospital that I currently work at now, but you don't have to like pay for a new one. You can just transfer the addresses.
Thank you. Another question a student had were there things you did while completing your master's that strengthened your application for advanced practice positions?
I think that I sought out some of my own clinicals for areas that I wanted to focus in. And then I also did the minor in the holistic nursing.
I think networking is huge, right? Both can I, right? Are there people am I doing clinicals at the place I might be interested in working at? Like that's one piece. And then the other is just keeping an ear to the ground. If you have colleagues who have left and worked at other places, what is the culture like for APPs there? Hey, you think you could maybe find me the manager's email so I could email them? Things like that can be really, really helpful.
Yeah, everyone in my cohort got their first job at a place they did their clinicals. So thinking about it 6 months ago or now, whatever timing this is happening for you, already start working those networks and like act like you would work there if you want to work there, so that you can reach out to those people as your first step. So they already know you and how wonderful you are.
Just one more question that we had was, so after you graduated, how long did it take to like find your first job? And did you feel like it was a competitive process?
I was offered my first job when I was still in midwifery school because it was a place I did clinicals at. But the piece that always sticks in my brain is it was at Stony Brook. I live in Queens. The job was at Stony Brook, and they presumed that I wouldn't want to work there because it was too far away. So I was just like chit-chatting with one of my preceptors, and I was like, she said something like, oh, but you would never want to work here. And I was like, yeah, I would. And she's like, what? Okay, you're going to apply. So talking to people about that in whatever way you can get it out there, I think is a lovely way to work the network that you already have if you're in clinicals or know people in a place that you want to work. Because they might presume that you don't want to work there and maybe you do, so bring it up.
I started to apply, I think, at the end of finishing my program. I don't think I applied beforehand. I was also planning a wedding. It was tail end of COVID because I finished or kind of right after COVID because I finished in January of 2021. Like we were rolling in it. And so did that, took my boards. Actually, I did a bunch of interviews before I took my boards, and actually took my boards on the day I went down to do an in-person interview and shadow shift at the job I'm at now in Philadelphia. But like I said, I turned down 2 jobs that I had gotten offered before it because I got the jobs and then, I was applying lots of places just trying to get a feel for what was out there and how competitive it was going to be. And then ended up realizing that neither of those jobs were going to be a good fit for me for a couple of different reasons. And so I was like, you know what? I'm going to be patient again because I had a job I didn't hate and had some wiggle room financially and was not necessarily in a rush. So I took my time. And like I said, I started my job 8 months after graduating, something like that. So I was slow.
Yeah, I think it depends on where you're applying to and just if there's a competitive aspect of the position you're applying to. I think I accepted an offer 2 months after I graduated. And then at least for my positions, it's always been 3 months after you accept the position is when you'll start. So you're going to have a little bit of lag time just because the credentialing does take a while to take effect.
Okay, well, I think that was our last question, unless someone else has any others. Janet, if you'd like to wrap up, I think that's the last question.
Sure. Again, thank you everybody for being here tonight. We were going to do breakout rooms, but I think we had such a great Q&A. I'm going to give everybody like one last chance. If you've got a question burning on your heart, put it in the chat real quickly. So anyways, but I appreciate all of our alumni who are here tonight. This was very informative. Lots of great information that was shared about this transition. It's, you go through all these transitions in life, you've already done one huge one, becoming an RN and now becoming an NP. So hopefully this was helpful tonight for all the students that are on the line. So again, we hope that we see you at future events and best of luck to you students. You're about to take your finals. Hopefully you'll get a lot of studying done in the next few weeks and knock it out of the park. So we look forward to seeing everyone again soon. Happy Thanksgiving.
Happy Thanksgiving.
Thank you, Jan.
Thank you, everyone. Have a good night.